Hi and welcome. My name is Cassie. I'm a prenatal and postnatal yoga teacher and corrective exercise specialist. And today I'm going to show you how you can check yourself for diastasis recti or abdominal separation. Diastasis recti, also known as DR, is a thinning of the linea alba tissue that connects our rectus abdominals, also known as our six-pack ab muscles in the middle. While you don't have to have been pregnant to have DR, men and women can have it of any age. It is extremely common postpartum because during pregnancy, this tissue is being stretched out as your belly grows. Almost all moms will have some degree of separation by the time they deliver. However, you can help minimize this separation by how you are loading the tissue. So if you are currently pregnant watching this video, be sure to check out my safe core work during pregnancy. While checking on yourself can give you a really good baseline measure and help you connect to this area of your body, if you want full accuracy, you will need to have an ultrasound, and it's a great idea to seek out a pelvic floor physical therapist or other professional that can give you an individualized plan for healing and restoring your core. We're going to start by laying down on your back, roll to your side, come onto your back. Lift your shirt up and roll your pants down a little bit so that you can feel. We're going to check in 3 places: halfway between your rib cage and your belly button, at your belly button, and then halfway between your belly button and your pubic bone. And what you are looking for is to see if you have a gap that is wider than 2 fingers or deeper than 2 fingers. So what I want you to do is just go ahead and find the middle of your belly, the midline, so at your belly button, and then slide yourself about halfway between the belly button and the ribs. And lift your head just barely off of the ground without activating your abs. So you're not activating or trying to do anything, just slightly lift your head. You can use your other hand to support it. And then see if you can find your 2 rectus bellies. So your right side and left side of your abdominal wall, and then feel that tissue that is in between, so the separation. And what you are looking for is a kind of firmish trampoline-like feel. So if you think about tightening the springs on a trampoline, that is going to give you more of a firmer feel. If you loosen those springs, your fingers are going to sink more. And again, you can either have more than 2 finger widths width, so separation from right to left, or you can have deep down to your second knuckle. So go ahead and try that out, see where you're at. And then same thing, so you'll want to check right at your belly button. This for me is where I had some separation. Currently I have just about 2 fingers width. And then lower your head. One more time, you're barely picking your head up. You're not doing a full crunch, you're barely lifting your head. And then feeling it halfway between your belly button and your pubic bone. And so find, again, those 2 bellies, and then see if you can find that line right in between. So the next thing that we're going to do is check to see how that separation feels when we go to engage our abdominals. So if you feel less depth, less width, if it starts to close together, that is a really good indication that you are properly loading your abdominals, correctly engaging these muscles, which is a really good indication of healing. Don't worry if you find that nothing changes or if it feels worse. That just means you're going to have to rewire your brain to learn how to properly engage these muscles and help them all coordinate and work together. So you are going to take a big inhale all the way around your torso. And then as you exhale, breathe out of your mouth, lift your pelvic floor, and start by pulling the hip points together, drawing the belly up and in. Lift your head up just like we did before,
And now check halfway between the ribs and belly button. Go ahead, lower your head, do that again. Big inhale. Really fill up front, sides, back. Exhale out of the mouth, lift the pelvic floor. Think of gathering everything together and up. Keep that tension as you lift your head. Check at your belly button. And then one more time, big inhale. Exhale, start by lifting the pelvic floor. So from the bottom up, try and flatten, lift and flatten everything together and down. And then check again halfway between the pubic bone and the belly button. And after you've done that, go ahead and just relax everything. It's important to let your pelvic floor relax, let the abs relax in order for them to work. They also have to know how to let go. And then you can roll onto your side, lift yourself up. And that is how you can do a self-assessment. If you did that assessment and you found out that, yes, I do have some diastasis recti or abdominal separation, be sure to check out some of my core videos, as well as speak to a professional that can help give you an individualized plan on healing and just helping you feel really good and strong in your body. If this video is helpful, be sure to give it a thumbs up and subscribe to my channel for more pregnancy and postpartum yoga videos.